So MRI, it's where we use a very strong magnet, and we are looking at the hydrogen atom within the body. What we do is put an RF pulse into the body, we excite the hydrogen atom, we then pick up the data from this hydrogen atom when it's coming back to its relaxed phase, and changing how we use our parameters within the MRI, we can look at the tissues in different ways, and therefore using the computers get 3D images to look at anatomy and look at pathology in MRI. We do a lot of neuro work, looking at the brain and the spine. We'll look at the MSK, so that's all your joints. So we'll do quite a lot of sports injuries. We look at body, a lot of oncology work, so looking for cancer staging. We are all aware that there are a number of challenges within radiology, and especially in MRI. There is a lot of old MR equipment being used in Scotland. To get new scanners, additional scanners, it's very costly. We had a trial of Deep Resolve, and it's using an AI algorithm to increase the signal that we receive on our imaging.
I had a 12-week trial initially of the software where we had a volunteer protocol in place through approval through the relevant governance groups, and we used healthy volunteers to optimise our images during the trial period. Since then, we proved that we could reduce our waiting times quite significantly, so we had funding secured through Scottish Government, which purchased the licence in this financial year, and for the first 6 months we've seen significant improvements in our waiting times. We're already scanning kind of 7 days a week already, so I'd kind of maximise our capacity already, and we're heavily reliant on third-party suppliers of mobile scanners.
We were using the mobile health, the mobile scanner, probably about 2 weeks every month, and it's very costly, and comes with some other issues as well, some other challenges. Over the last 6 months of having the actual software on our scanner, we have managed to increase capacity, get all the patients done on our static scanners, reduce waiting times, and we've actually improved image quality for a lot of the scans.
Well, a lot of patients are claustrophobic as well, so or they're lying in pain, so having a quicker scan, we get better patient compliance. Sometimes maybe we'd have to curtail the examination halfway through, whereas now the patients can maybe tolerate the full examination. So yeah, and that helps with the diagnosis as well.
We are just short of 1,900 extra patients that we've actually fitted in on the 2 sites in Fife.
So it has put extra pressure on staff, obviously, to get as many patients through as we can. So we've had to balance that with the staff health and well-being as well, to make sure they're not burning out. We
can either improve the quality, or we can increase the actual, or reduce the scan times. What we've actually gone is a bit of both.
The first 6 months, obviously we had the cost of the licence as well, but we've not used third-party suppliers for mobile units for the first 6 months of that, so that saved us about £220,000. It's been massive for our patient workflows, having the software on both scanners, both on the acute site and on the outpatient Queen Margaret scanner. We've seen reductions in waiting times from outpatients and also for the acute inpatient sector as well.